Hi, I'm Dr. Damien Lafferty, a podiatric surgeon from Sydney. If you've had heel pain for more than 3 months, tried stretching, orthotics, steroid injections, maybe shockwave, but nothing is improving, then there's a strong possibility you've been given the wrong diagnosis, because most chronic heel pain is not plantar fasciitis, it's something different. It's called plantar fasciosis. The condition starts as plantar fasciitis, yet when it does not heal, it degenerates into fasciosis. And that distinction is the difference between getting better and staying stuck. Let's simplify this. Plantar fasciitis means inflammation, but when we look at chronic heel pain under ultrasound and histology, we don't see inflammation. What we actually see is collagen breakdown, disorganized tissue, thickening of the plantar fascia, micro tearing. This is a degenerative condition. So the correct term is plantar fasciosis, and this matters because you cannot treat a degenerative condition with anti-inflammatory strategies and expect it to resolve. Most patients are told to stretch the calf, ice the heel, use orthotics, take anti-inflammatories, rest, and early on some of these can help. But if your pain has been there for months, they often fail. Why? Because stretching alone doesn't rebuild damaged collagen, ice doesn't reverse degeneration, anti-inflammatories target a process that isn't dominant. So what happens? Temporary relief, then plateau, then frustration. Chronic heel pain is rarely one single issue. In most cases, it's a combination of factors. One, degenerative plantar fascia, the tissue is thicker, weaker, and less able to tolerate load. Two, mechanical overload. This can come from tight calf muscles, increased body weight, long hours of standing or walking, poor load distribution through the foot. Three, nerve involvement, commonly missed. This is critical. Structures like Baxter's nerve, medial calcaneal nerve, can become irritated or entrapped, and when that happens, pain persists, even if you treat the fascia. 4. Bone stress response. In some patients, MRI shows bone marrow edema in the heel. That's a sign of chronic overload at a deeper level. If you don't identify all contributing factors, treatment will fail. That's why proper diagnosis is essential. This includes high-resolution ultrasound. This allows us to measure fascia thickness, identify degeneration, detect tears or abnormal blood flow, targeted clinical assessment, looking at load tolerance, calf function, foot mechanics, signs of nerve involvement. Without this, you're guessing. And guesswork is the reason many patients stay in pain for years. What actually works? The evidence-based approach. The key principle is simple. Chronic plantar fasciosis requires a combined treatment strategy. Not one treatment, not a quick fix, a structured, layered approach. One, address nerve entrapment. It is estimated that 20% of chronic heel pain has nerve involvement. It must be treated directly. This may include ultrasound-guided hydrodissection. If you ignore the nerve component, the pain often does not resolve. 2. Regenerative injections. Selected cases. Examples include prolotherapy, platelet-rich plasma, PRP. The goal, stimulate tissue repair. In the right patient, it can be effective. But it works best when combined with rehab, not in isolation. 3. Load management and progressive strengthening. This is critical, not just stretching, but controlled loading. Why? Because collagen responds to load. Proper loading improves tissue structure based on well-established tendon rehab principles. 4. Orthotics review. Orthotics can often still be utilized. However, they can be modified to be more comfortable and easier to fit into shoes. You rarely require new devices. 5. Surgical options for recalcitrant cases. Only when conservative care fails. Options may include partial plantar fascia release nerve decompression. Luckily, thanks to advances in ultrasound-guided dissection and regenerative medicine, this can be avoided in the vast majority of cases. However, if all else has failed and in the right patient, surgery can be highly effective, but it must be targeted, not generic. The biggest mistake patients make is this, treating chronic heel pain as a single issue condition. It's not. It's usually degeneration plus overload. Nerve involvement. If you only treat one part of the problem, you will not get a lasting result. If you've had heel pain for more than 3 months and you've tried the standard treatments without success, you don't need more of the same. You need a precise diagnosis, a structured combined treatment plan, because once plantar fasciosis is treated properly, that's when patients finally start improving. If that sounds like you book an assessment and get it managed properly from the start. Thank you for watching. I'm Dr. Damien Lafferty, surgical podiatrist. This is my opinion, developed over 12 years of education and almost 30 years of experience. If you have any questions, please feel free to ask, or you may want to subscribe or watch the next video.